Very glad to be here and to advance the story about the failure of this government to be moral. $2 billion has been paid out by the United States government as compensation for the death or disability of children who have been forced to take vaccines that cause their damage. $2 billion. It is not possible for a country to be moral if it requires every one of its children to consume a product knowing that some of them will die and some of them will be maimed. That is fundamental immorality. I first had the issue of vaccination policy called to my attention in 1970 by John Gardner, former Secretary of Health, Education, and Welfare. He called me to say that as Secretary, there were things going on in vaccine regulations that were bad and dangerous, which he did not become aware of until after being Secretary. Would I be willing to look into them? At that time, I was working with Ralph Nader as an original Nader's Raider, and I had just completed a book called The Chemical Feast, the Nader Report on Food Protection at the FDA. Another disaster in American society for another day. What Secretary Gardner wanted to know is what kinds of things were going on in vaccine regulation that were comparable to the kinds of things we had found in food regulation. And so I started. And it was an unbelievable wasteland of mismanagement, ignorance, and dangerousness on the part of the government. Secretary Gardner introduced me to an FDA, it wasn't an FDA at the time, an NIH researcher, Dr. J. Anthony Morris, who was a microbiologist who had spent his entire career working on vaccines, starting in 1943 at the Walter Reed Hospital. And Dr. Morris and I and some of the people working with us went and talked to virtually every single vaccine regulator at that time. And in every instance, the vaccine they were regulating posed a serious safety and efficacy problem. DPT was said by the person in charge of regulating it to be the dirtiest substance ever put in the human body. The cholera vaccine was said by the person regulating it that it did not address the disease, it only masked the symptoms. And one of the results of that was it spread the disease. The quality control officer said, this is 1973, there's mercury and other heavy metals in the vaccines that we're not reporting to anyone. It's 1973. And issue after issue in vaccines went that way. We met with the scientist responsible for creating CDC. At that time, he was a professor at Harvard. And he told us how he had been fired from the CDC for refusing to issue the annual announcement urging the American public to take the flu vaccine. This entire picture was a bizarre picture. Recently, I spent some time with Tony Morris, talked to him about what we had discovered and found, and I asked him what he would say to this group today. And he told me to say, I didn't take the flu vaccine. He's 92 years old. A long life is the best answer. Thank you very much.